Knock, knock. Hi, my name is Lindsay Keating. I'm with the University of South Alabama's College of Nursing, and I'm here to do your neurological assessment today, if that's okay. Okay, can I have you stand up for me, please? All right, you look clean, well-groomed. Your posture looks erect. Your behavior is you're going to smile at me, and you're awake and you're alert. Now, do you have any problems with depression or anxiety? Okay, and if you did, I'd get the proper screening for you. So now I'm going to test your cognitive memory. So what is your name?
Emily.
And where are you? And what time of day is it?
Afternoon.
Okay, great. So now I'm going to test your recent memory. So I brought you a tray of food for breakfast this morning, and what did you have on it?
Toast and eggs.
Okay, great. And now I'm going to test your remote memory. So who was the president before Donald Trump?
President Obama.
Okay, great. So now I'm going to test your abstract thinking. So if I told you to find a needle in a haystack, what would that mean to you?
It's hard to find.
Okay, great. So, and then I'm going to test your judgment. So if you saw blue lights behind you when you were driving, what would you do?
Pull over.
Okay. And where do you see yourself in the next 2 years?
Married in North Carolina.
Okay, great. So can I have you sit back down for me, please? So we're going to test your cranial nerves. So cranial nerve number 1 is your olfactory nerve. And your the way we're going to test your olfactory nerve is I'm going to have you occlude one nostril and sniff for me. Okay, and do the other side. Okay, so the next thing we're going to do, I'm going to have you close your eyes. And you're going to do the same thing and occlude one nostril. And I'm going to have you smell this for me. Can you sniff? What does it smell like?
Peppermint.
Okay, keep your eyes closed and we're going to do the other side. And what does this smell like?
Vanilla.
Okay, great. So cranial nerve number 1, your olfactory nerve, is intact. So now we're going to move on to your second cranial nerve, which is your optic nerve. And normally we would test this with a Snellen eye chart. You would stand 20 feet back from it and you would occlude one eye, or cover up one eye, and you would read the lowest line you possibly can. But today we're going to use this handheld vision screener. I'm going to measure you for it. Okay, so can I have you cover up one eye and read the lowest line you possibly can?
DEFPOTEC.
Okay, great. So you have 20/20 vision, which means that what the normal eye can see at 20 feet, you can also see at 20 feet. So cranial nerve number 2, your optic nerve, is intact. So now we're going to move on to cranial number 3, which is your ocular motor nerve, cranial nerve number 4, which is your trochlear, and cranial nerve number 6, which is your abducens. So cranial nerve number 3, the way we're going to test it, I'm going to look at your pupils, and I see that, can you look at me? Your pupils are round and equal, and I'm going to measure them, and they're about 5 millimeters. Now we're going to test for directed consensual pupillary light reflex. So can you look at my finger for me? And your pupil did constrict, so that's direct light reflex. So now I'm going to look at your other pupil, and your pupil had consensual light reflex. So now can I have you look at that sign for me? And now look at my finger, and your pupil's constricted and dilated. So that means that pupils accommodated. Now can I have you look at my finger to go in? And your pupils did converge. So your pupils are equal round, reacted to light, accommodated, and converged. So now I'm going to move on. So that's your cranial nerve number 3, your ocular motor nerve. Now for cranial nerve number 4, your cranial nerve number 4, which is your trochlear, and cranial nerve number 6, which is your abducens. I'm going to do extraocular movements and 6 cardinal movements of gaze. So can I have you look at my pen light? Go up. Good. Okay, so cranial nerve number 3, your ocular motor, cranial nerve number 4, your trochlear, and cranial nerve number 6, your abducens, is all intact. So now I'm going to move on to cranial nerve number 5, which is your trigeminal nerve, and I'm going to test the motor portion first. So can I have you clench your jaw, and I'm going to palpate you. Let me know if you have any pain or tenderness. Right, any pain or tenderness? Okay, good. So now I'm going to pull down on your chin. You just prevent me from doing so. Great. So cranial nerve number 5, your trigeminal nerve, the motor portion is intact. So now I'm going to test the sensory portion. Now I'm going to touch your face in places. You just tell me now when you feel it. So I'm going to close your eyes.
No.
Good. So cranial nerve number 5, trigeminal nerve, motor portion, and sensory portion are intact. So now I'm going to move on to cranial nerve number 7, which is your facial nerve. So I'm going to have you make some funny faces for me. So can I puff out your cheeks? Okay, smile, frown, stick your eyebrows up. Okay, so now I'm going to have you clench your eyes pretty tight.
Okay.
Yep, close them, yep, and then I'm going to try to open them from you from doing so. Okay, great. So cranial nerve number 7, your facial nerve, is intact. So now I'm going to move on to cranial nerve number 8, which is your acoustic. So can I have you cover one ear? Okay, I'm going to cover my mouth. I'm going to whisper a word to you. You repeat that word back to me.
Okay.
Parasite.
Nursing.
Okay, can you do the other ear for me?
Jaguar.
Okay, great. So cranial nerve number 8, your acoustic nerve, is intact. So now we're going to move on to cranial nerve number 9, which is your glossopharyngeal, and cranial nerve number 10, which is your vagus. So I'm going to have you open up your mouth for me, please, and say ah. And your uvula is midline and rose in phonation. And so cranial nerve number 9, your glossopharyngeal nerve, is intact. And today, for cranial nerve number 10, your vagus nerve, your vagus nerve, we're not going to test that today, but normally I would take a tongue blade and elicit the gag reflex. But today we're not going to do that. And for the sensory portion of cranial nerve number 10, I would normally stick a salty or sweet taste on the anterior 2/3 of your tongue, but today we're not going to do that. So cranial nerve number 9, your glossopharyngeal, and cranial nerve number 10, your vagus nerve, are intact. So now we're going to move on to cranial nerve number 11, which is your spinal accessory nerve, and I'm going to push against your face, and you push against it, okay? Okay, now other side. Now can I have you shrug your shoulders, and I'll push against them. Okay, great. So cranial nerve number 11, your spinal accessory nerve, is intact. So now I'm going to do cranial nerve number 12, which is your hypoglossal nerve. And so can I have you stick out your tongue for me? Okay, so your tongue is midline and does not deviate or shift to the left or the right. So cranial nerve number 12, your hypoglossal nerve, is intact. So now I'm going to move on to the motor portion. So can I have you stand up for me? Okay, so can I have you walk that way for me? Okay, so your gait is smooth and rhythmical, and I do not note for any sway. Okay, so now can I have you tandem walk, which is your toe to heel, right. Great, so I do not note for any swaying. Great, so now can I have you stand right here for me and put your toes, feet together, and hands by your side, and I'm going to have you close your eyes. So I'm going to test for the wrong vertex. Normally I would test for 20 seconds and support my patient, but I do note that she has minimal swing. Okay, great, so you can open up your eyes. So now I'm going to move, you can sit back down. I'm going to move on to the sensory portion. So this is sharp, and this is dull. So I'm going to have you close your eyes, and I'm going to touch places on your forearms and your legs, and you tell me if it's sharp or dull, okay?
Sharp.
Okay.
Sharp. Dull.
Yes. Okay.
Dull.
Okay.
Sharp.
Okay, great. So your sensory portion is intact. So now we're going to move on to, I'm trying to think of where we're going to move on to. Okay, I'm going to test your deep tendon reflexes. So I'm going to test your bicep one first. So can I have you just relax for me and put your arm out like this? Okay, great. Okay, perfect. Thank you. You feel anything? Yeah. Okay, great. Okay, so now I'm going to move on to your tricep tendon. Okay, you just relax your arm. Let me hold it for you. Okay, great. So now I'm going to move on to your brachioradialis. I'm going to hold you here. You just let me hold on. You feel that? Okay. So now I'm going to move on to your patellar. Okay, I'll do the other side. Okay, great. So now I'm going to move on to your Achilles. Okay, so now I'm going to do your Babinski reflex. Okay, great. So throughout this entire exam, I was using the glass coma scale. And the glass coma scale, you have the lowest score you can do is a 3, and the highest is a 15, and anything below a 7 would reflect a coma. So I would give you a score of 15. I would give you 4 points for my eye movements. I'd give you 5 points for the sensory portion, and I'd give you 6 points for the motor portion. So I'd give you an overall score of a 15, and that completes my neurological assessment.